Zandspruit in Johannesburg. When compared to other townships in Africa and across the world, Zandspruit is not large. A few square kilometers and less than 100,000 people. The public services are minimal and sporadic. Access to healthcare is limited by the same factors as many other places, mostly poverty and the lack of reliable and affordable transportation. There is a small government clinic, but it's underfunded, understaffed, and overwhelmed. It's a difficult, even heartbreaking place. But Zandspruit also represents the norm. There are thousands of Zandspruits in scores of countries, which makes it an ideal place for a new kind of approach to healthcare that seeks to learn and evolve as it treats and educates. Specifically, primary and preventative care for diseases that, in accelerating measure, are eroding the health of millions and challenging the capacity of governments and NGOs. Hypertension and diabetes. In this first-of-its-kind setting, the Hope Center, Project Hope is leading an innovative collaboration to prevent diabetes and hypertension, detect these diseases early, care for the most immediately in need, and teach them how to manage their disease over a lifetime.
We're able to go into the community and talk about what diabetes and hypertension is, screen them for it, and make the appropriate referrals. We run a clinic 3 days a week, improving clinical care using point-of-care testing. And then the final component is peer support groups. And we educate the patients for about a year on what their disease is, what it's doing to them, and how they can manage it.
And why hypertension and diabetes, especially when infectious diseases like HIV and TB rage on? Treating those patients has weakened the health ministries here and across sub-Saharan Africa. Meanwhile, urbanized and rapidly modernizing populations are facing increasing rates and severity of diabetes. Healthcare providers are seeing late-stage diabetics, some for the first time. The poor outcomes they experience, blindness, amputations, and more, diminish the community's strength and cost the system far more than prevention, early detection, and timely disease management. Of course, early intervention is not a new idea. What is new is the execution of that idea, the hands-on collaboration that's propelling it, the deep data analysis that will emerge, and the potential to scale up new, more effective solutions. The lead corporate partner is Eli Lilly and Company, and this is the latest collaboration in a relationship that dates back to 1959. In Zandspruit, Lilly is working with Project Hope, not only to support the work financially, but also operationally. In May of 2013, a team of skilled Lilly employees went to work shoulder to shoulder with the Hope Center staff. Lilly people observed, analyzed, and made recommendations. They were on site for 2 weeks. The impact of their work will last far longer.
It's been an absolutely amazing experience with them. We've managed to do things in 2 weeks that would have taken us over a year to get done. They're going to leave us with, I think, a stronger program, a stronger staff, and I think overall just a much more solid program to build upon in the future. The staff are very receptive. They're like sponges. They really want to learn everything they can about diabetes, about hypertension, about how to run the clinic. They want to do more, and they realize that they need to have training to be able to do more, so they're very receptive.
It's partnerships with the community that will bring lasting change here. And the stories are good, remarkable even. But anecdotes don't drive real change. Reliable data, passionate advocates, and purposeful action are the engines of deep and sustained change. It starts in this small township that's both desperate and typical. Keep watching Zandspruit Johannesburg. The work here is just beginning, but it's a different kind of beginning, with a bigger ambition and a stronger hope.